Hello and welcome. Thank you for joining. My name is Rebecca Preza, and I am the Healthcare Facilitator at UC Santa Barbara. And in this video, I will be covering the Retiree Open Enrollment highlights. So as you know, our open enrollment dates start Thursday, October 29th at 8 a.m. and ends Tuesday, November 24th at 5 p.m. As a friendly reminder, please be sure to submit all of your open enrollment elections via your UC Raise account by 5 p.m. on Tuesday, November 24th. I'd like to take a moment to cover some frequently asked questions. The first, if I like what I have, do I have to do anything during open enrollment? The answer to this question is no. If you're happy with your plans, you do not have to make any changes during open enrollment, and whatever you are currently enrolled in now will continue in January. When do open enrollment changes become effective? So all changes become effective January 1st, 2021. And lastly, how do I enroll or change my medical, dental, or legal plans? So to go in and make elections, you must sign in, or if you've not yet signed in, register on UC Raise. If you need assistance registering or uh, setting up your UC Raise account, you can also contact RASC at 1-800-888-8267. And if you'd like to take a moment to pause this video, you can actually scan the QR code here, and this will take you directly to the login page for UC Raise. So all of the medical plan offerings for both our non-Medicare plans and our Medicare plans will continue in 2021. So you can see a lot of the plans here are going to be exactly the same. That for our non-Medicare plans, the UC Blue and Gold HMO, Kaiser Permanente HMO, UC Care, PPO, Health Savings Plan, and Core will all continue for 2021. And our Medicare plans will also continue UC Medicare Choice, Kaiser Senior Advantage, UC Medicare PPO, UC Medicare PPO without prescription, and the UC High Option will all continue for 2021. Finally, VIA Benefits will also continue as the administrator for our Medicare Coordinator Program, and that's for all our Medicare eligible families living outside of California. For those retirees who are in split families, where you have a family member who is in Medicare and family members who are in non-Medicare plans, those partner plans will remain the same in 2021. So for those family members, those non-Medicare family members enrolled in UC Blue and Gold HMO, the partner plan will be the UC Medicare Choice. Kaiser HMO, the partner Medicare plan will be the Kaiser Senior Advantage HMO, and then of course the UC Care PPO and the core PPO plans, the partner Medicare plan will be the UC Medicare PPO. As a reminder, the health savings plan is not available for split families. So if you are currently enrolled in the health savings plan and one of your family members is going to become eligible in the coming year, you will have to change to either UC Care PPO core PPO plan with the partner UC Medicare PPO plan. So here are some non-Medicare medical plan changes, specifically for the UC Blue and Gold HMO. The emergency room copay will increase from $75 to $125. This copay will be waived if you are admitted. The annual out-of-pocket maximum will exclude copayments for hearing aids and infertility treatments as of January 1st, 2021. And the telehealth provider will change from Teladoc to Babylon. Babylon is a smartphone-based app. Using this app, you can schedule behavioral health and medical appointments. And then you have the ability for referrals to in-network urgent care and specialty referral recommendations to your primary care physician. The early prescription refill policy, there is also a change to the number of days in advance that a refill can be obtained. So the specialty number of days to fill a specialty will reduce from 7 days to 5 days. For retails, it will reduce from 7 days to 5 days, and then mail order from 23 days to 16 days. Again, because we are currently utilizing a lot more telehealth services, I wanted to just highlight on the new telehealth provider for UC Blue and Gold HMO. So this was formerly Teladoc. The new provider as of January 1st, 2021 will be Babylon. And again, this is an app that you want to download on your phone via your Android or your iPhone and register with the following code. If you have a child who's under 18, you can also register them on your account as well. So slides, I'm just showing you how you can go in and register and download that app. Kaiser Permanente HMO, the emergency room copay, much like the UC Blue and Gold HMO plan, will increase from $75 to $125. Again, this copay will be waived if you are admitted. Another change is the outpatient prescription drugs with an over-the-counter equivalent will be excluded from coverage. So this is for drugs with the same active ingredient, strength, and dosage form as the prescription drug. This does not apply to insulin or over-the-counter drugs considered preventative, and it's an entire class of prescription drugs when one drug within that class becomes available over the counter. Some changes under the UC Care PPO plan. The calendar year deductible will increase for Tier 2 Anthem Preferred and Tier 3 out-of-network. So for our individual, your annual deductible will increase to $500 for your Tier 3. Your annual calendar year deductible will increase to $750. For the family, your Tier 2 deductible will increase to $1,000 and your Tier 3 will increase to $1,750. Also, the coinsurance will increase from 20% to 30%. So for the 2020 plan year, Anthem would pay 80%, you would pay 20%. For the 2021 plan year, Anthem will be paying 70%, you will be paying 30% for the following. That would be office visits, inpatient services, outpatient services, and then this change only applies to services obtained in the US. The ER care without admit will increase from $200 to $300 on all tiers. And then there will be a decrease to your urgent care copay. It will decrease from $30 to $20. Finally, your out-of-pocket maximum, that's your combined medical and prescription out-of-pocket maximum, will increase by $1,000 on all tiers. So for an individual, your Tier 1 will increase to $6,100. Tier 2 will increase to $7,600 and Tier 3 will increase to $9,600. And then for the family, it will also increase. Your Tier 1 will increase to $9,700, Tier 2 will increase to $14,200, and Tier 3 will increase to $20,200. For the health savings plan, the only change is that the IRS is increasing the maximum contribution. So the maximum that an individual can contribute is going to be $3,600. For a family, that would be two or more, will increase to $7,200. And then there's also that $1,000 catch-up contribution for each family member who is at least 55 years old. For core, there are no changes for 2021. For Medicare medical plan changes, there is the 2021 Medicare regulatory changes, and that is that the troop will increase from $6,350 to $6,550. And that troop is your true out-of-pocket maximum. And then there is a low income subsidy. There will be incremental increases from 2020 to 2021 for the low income subsidy. Continuing with our Medicare plan changes for Kaiser Senior Advantage, the outpatient prescription drugs with an over-the-counter equivalent will be excluded from coverage. So again, these are drugs with the same active ingredients, same strengths, same dosage as the prescription drug. And again, this does not apply to insulin or over-the-counter drugs considered preventative, such as tobacco cessation and contraceptions. And it's an entire class of prescription drugs when one drug within that class becomes available in over-the-counter. Another major plan design change that is going to that impacts all of our Anthem plans, that's our UC Care Health Savings Plan Core, as well as our UC Medicare PPO, UC Medicare PPO without prescription drugs, and High Option, is that the Anthem Engage Elite Plus mobile app and pricing tool will be terminated. So this program will terminate as of January 1st, 2021. And again, this applies to all of the UC Anthem plans, both Medicare and non-Medicare. So the 2021 plan costs for UC retirees, the monthly cost for medical coverage that I'm about to show you in the next couple slides is going to apply to retirees eligible for 100% the UC employer contribution toward the premium for each plan. If you are subject to graduated eligibility and not eligible for the maximum UC employer contributions, your costs may be higher than those listed in the presentation. To see these costs, you can actually access them by signing into your UC Raise account beginning October 29th, 2020 to see your 2021 costs. And this QR code will actually take you directly to the 2021 plan cost for retirees on the UCNet website. So here are your plan costs when all family members are in Medicare. Again, this is the rates for when all family members are in Medicare. If your premium is zero, then you might be eligible for Medicare Part B reimbursement. Again, that Medicare Part B reimbursement will be added back to your UC pension. So again, if your premium is zero, your Medicare Part B reimbursement will be added back to your pension. Whereas for those whose premiums are not zero, that will be the amount that will be deducted directly from your UC pension. Here are the rates when one or more family members are not Medicare eligible. So these are specific to those families who are in those partner plans who have split families, some in Medicare, some not in Medicare. Here are your rates for 2021. Again, these rates that are being advertised are for those folks who are eligible for the maximum contribution. Here are the rates for those retirees who are not yet Medicare eligible. So here are the rates for our non-Medicare plans. Finally, we have the non-Medicare plans for age 65 and over who are not Medicare eligible. So Delta Dental will continue as our dental provider for 2021. There are no rate increases. Again, that's for those folks who are eligible for the maximum UC contribution. For retirees with graduated eligibility, you will continue to pay the share of the cost for dental insurance. So the Delta Dental PPO does have a couple of changes. The first being the crown and prosthodontic replacement frequency will change from once every 5 years to once every 7 years. And then covered exams will be reduced from 4 per year to 2 per year as of January 1st, 2021. Under the Delta Care USA HMO plan, the Crown Fusion copay will increase from $50 to $150. And then we are still waiting some final confirmation of any other mandated changes. For Vision, VSP will continue as the administrator. There are no plan design changes. There are some enhancements. The first being that the network will change from VSP Choice to VSP Advantage. Walmart Vision centers have been added to the network, and there is a 15% cost reduction for what you will pay for vision services. Again, vision is paid in full by the retiree. So if you are interested in signing up for vision, you must contact a VSP directly to enroll. And here you can see that I have the quarterly and annually out-of-pocket costs that it will be for you and your family members to enroll in vision insurance. ARIG will continue as the legal insurance provider. There are no rate changes. However, there are some plan enhancements. There is the new diversity and inclusion services, which was really pushed by UCOP. So this enhancement will include domestic partnership agreements, funeral directives, hospital visitation authorizations, and then the gender identifier changes on government issued documents. So again, there are no rate changes, but there are some enhancements to the legal insurance as of January 1st, 2021. Finally, I wanted to just cover the many resources that are available to you. The first being the UC Virtual Benefits Fair, which you can access 24/7. You can attend plan hosted webinars. You can connect with the plan administrators and ask questions. The UCNet Open Enrollment website, where you can access the open enrollment content and 2021 plan rates. You can access the which Medicare plan is right for you and the which medical plan is right for you if you're not yet eligible for Medicare. Karen Rasmussen is also available if you have questions or need assistance. And then you can also reach out to myself, Rebecca Preza, the healthcare facilitator. And then here I have the QR code where I have recorded videos of the retiree open enrollment highlights, as well as the new to Medicare. If you're becoming eligible for Medicare in this coming year, you need to know what to do and what that transition is going to look like. You can access that video by scanning the QR code below. Let's continue to stay strong and stay healthy.